Hi guys, I have hesitated making this video because I don't want to offend anyone, but I also need to clarify the difference between type 1 and type 2 diabetes, because I think sometimes people get confused when I'm talking about my daughter, who is 6 years old now, who has type 1 diabetes. I think they get confused with the type 1 and the type 2 diabetes. If you have not been here before, I am Mama Bear to Many. I am mom to 14 children. 12 of my children still live here at home, and our 6-year-old is a type 1 diabetic. She was diagnosed at age 5 after she went into something called DKA. And she was in the pediatric ICU for 3 days. And then after that, we've been dealing with type 1 diabetes and figuring it out all along the way. So I just want to go over the differences. Type 1 diabetes is an actual autoimmune disease. Type 2 diabetes is not an autoimmune disease. So type 1 diabetes, basically the immune system, autoimmune diseases are something that's attacking the immune system. So it's actually attacking the parts of the pancreas that puts out, I'm not using the technical terms because let's face it, most of us aren't technical people, right? So it attacks the cells inside of your pancreas that puts out your insulin. So what happens is your body stops putting out insulin, and you don't know that that is happening until you get usually really sick. Throughout this video, I might need to stop and cough or whatever. I have a cough drop in my mouth. So I've been sick, but honestly, this is probably the best time for me to make one of these videos because when I'm sick, I also can get really reflective in just different things. So I figured that this would be a good time to make this video. So type 1 is an autoimmune disease that attacks your pancreas. There has been some question. This can run in families. A lot of times it does run in families. But it also, from talking to nurses that will not publicly say these things, there has been a huge increase in type 1 since 2020. And one thing with that disease, let's say, it is something that can attack your pancreas. And so they don't know the exact correlation between the two, but they have noticed a huge uprise in that. We don't know what caused whatever, but we just deal with what's there, right? You always deal with what you're presented. So type 2 diabetes, I'm just going to go from the starts as far as how you would get that. So you wouldn't know that you would get type 1, and it's always in children. And it usually occurs, sometimes there's people on boards that have babies that are 9 months old that get diabetes. And it has nothing to do with their diet or anything like that. Their immune system attacks the pancreas and makes the pancreas shut down. So there's nothing that you can really do to prevent that. Then type 2 diabetes is usually a later, although over the past few years, younger kids have been getting it because of the diet. The standard American diet is not a good diet, and it's causing kids to get diabetes earlier and earlier, which honestly is really, really sad. And we as parents have to kind of take control of that too, because we don't want our kids to get sick. Diabetes is serious. So that said, it is usually, I don't want to use the words that the internet uses, but I guess I'll say what the internet says. I don't believe this is always the case because there's skinny people that inside, it's kind of like a fat person in a skinny person's body. It's more of what you're eating. So most of the time, people who get type 2 diabetes are not very active people, and they are usually heavier weight. And because of the quality of their diet, they develop diabetes, which is their pancreas still works. It still produces insulin, but it doesn't know what to do. It gets really confused on how to produce insulin. I'm not going to go over gestational diabetes because that's a kind of like a totally different realm. We're just going to go over these two today. So that is usually the cause would be lack of exercise and poor diet would cause type 2 diabetes. The good news is for somebody who is type 2 is that to help type 2 or to reverse type 2, you need to just reverse the cause of that. So reversing the way that you eat, eating a low carb diet, eating, and when I mean low carb, I'm talking about like keto type diet, like really low carb, not, hey, I'm watching my carbs, and low sugar diet. I have never had to deal with type 2 diabetes personally. I have had to deal with some other issues in myself, just different issues. And I've also dealt with different issues with my children that required serious diet changes. But that said, I'm not in like your shoes. If you have type 2, I'm not in your shoes. But I would suggest that you go. I know Dr. Berg is on YouTube, and he does quite a few different videos about diabetes. There's also another guy, his name is, oh my goodness, this is kind of funny. And I feel so, if he ever watches this video, this would be so embarrassing. His name is, I think, Ken Berry. Okay? And for some reason, I don't know, maybe I've watched too much Strawberry Shortcake in my life, but I always think Carrie Berry. And then I like Googled that thinking that was really his name, and it's really not. I think it's Ken Berry. I'm almost positive that's his name. He does some information about diabetes as well. Both of those channels talk about reversing diabetes. There are a ton of success stories in people who have had to, that we're in that position and have reversed diabetes. So the good news is if you get that diagnosis, there is hope in that, right? So somebody who is type 1, before they came up with insulin, would have died. Their body wouldn't be able to produce insulin. What they used to do is they would put them on a very low carb diet. And okay, I don't really know where we were because my daughter came in and needed her insulin shot. So for a type 1 diabetic, they need insulin for everything that goes into their mouth. So the endocrinologist helps them figure out how much insulin is going, and it's a game. It really is. They figure out how much insulin they need for the amount of carbs they have. So everything is math. So if she eats 20 carbs, she would need, it would be like, she gets a unit for half a unit, 0.5 units for every 10. Now, some kids, it might be half a unit for every 5, every 7, every 15. It's just every child, and it might be seasons of life because hormones change your insulin. Sickness changes your insulin. She definitely needs more insulin if she's sick. I really kind of wanted to go over this because I just got an alert that there is an insulin shortage. And I want people to understand the differences. So maybe some people who are type 2 might be able to control their diets better without using insulin. And that would be super great. Obviously, it's a concern for us. If we can't get insulin, then my daughter dies. That's a concern. We just try to be cautious on those things and how we're doing things and such. So for every meal that she has, we have to figure out the exact amount of carbs and then figure out the amount of insulin she needs for the amount of carbs that she is having. And then we also need to figure out, she has a Dexcom, but we have to figure out what her levels are at that point. A normal blood sugar is 83. And so we are trying to keep her, everyone should be trying to be between 70 and 120. I think maybe it's up to 150 for adults. I know kids, it's like, anyway, I don't have the chart right in front of me. I'm trying to like think, but then I'm like, no, I don't really want to say that because if it's not correct, I don't want to be correct. You guys can look up the numbers. For Sweet Pea, we try to keep her between 70 and 150, which doesn't happen. It doesn't. It does a lot throughout the day. We try to keep it. That's the goal, right? Things that can happen long term if their sugars are too high all the time is they can get sick. They can have serious dental type issues. They can lose limbs. They can, yeah, it's hard. It's a lot. I mean, ultimately they can die, right? So it's serious business. So every single meal, everything she puts in her mouth needs to be accounted for. So she's 6 years old. Somebody had mentioned whatever about me locking up snacks or whatever in the cabinet. Let me just say, if she goes too low, if she goes below 70, I give her 6 sips of a juice box. 6 sips of a juice box. And that will usually bring her up to around 140, 150. Sometimes I'll give her 6 sips on a juice box and it will bring her to 250. Okay? So just a couple sips on a juice box could be detrimental. It could spike her like nobody's business. So keeping things safe for my family is ultimately my number one goal. And that's why we do what we do. Okay. Did you have some bread? Okay. Then I guess you're all done with lunch. She doesn't like tomato soup today. So somebody with type 1 also has what they call long day. So that's kind of like your background insulin, just like your body would make background insulin and always have insulin. And that would cover things like emotions. So if she gets emotionally upset or if she gets sick or something like that, then her body's going to spike and crash, because your body automatically takes care of those things. Like God created it perfectly to be able to do that. So type 1 diabetics are 100% insulin dependent. There's no, if somebody says that they are type 1, that means that they need insulin. End of story. Type 2, you do not need insulin. Sometimes it gets so bad that they do require insulin. Yeah, I think that's hard because we are in a society where the doctors and lots of people get paid if you're not healthy. So a lot of the recommendations for type 2 diabetes are a bunch of nonsense because they get paid more money to keep people sick. They get paid for more patient visits. They get paid more money as far as insulin goes. Insulin is expensive, let me just tell you. So they get paid more money to keep you sick. So it's your responsibility as a mom, as a parent, as an individual. It is your responsibility to know about your health care. So we always need to know what her numbers are, no matter what. She has a Dexcom, which normally works fairly well. You have to check fingers and stuff usually the first couple days to make sure that it stays within that range, that it's reading correctly, right? You have to calibrate it sometimes to make sure that it's reading correctly. But for overnights, it's really helpful because she usually crashes overnights. So if she crashes overnight, a lot of times we have to keep her high right before bed, keep her at around 180 to 220, so she doesn't crash really low by 4 in the morning. And it just depends on the child. You need to know what your numbers are and what their numbers are so that you are able to regulate that better. But they can crash in the middle of the night. And what would happen if they crashed and they didn't have a monitor? They would go to sleep forever. They would go to sleep forever. I think sometimes that it can bother me a little bit when people have type 2 and they associate themselves with type 1, because I really think that they should be two separate things, because it's two separate conditions. Type 1 is an autoimmune disease. Type 1 is very serious. Type 1 is deadly. It used to be deadly. It's just because we have insulin now that it's not. Other considerations are you have to try to get your insulin and your food to meet in your body at the same time. So say your insulin gets to your body before your food gets to your body. That means that you would crash. And it means you would go really, really low, which can be an emergency situation, can be unconsciousness, or even worse. So we have emergency things to handle that. If you gave them insulin and they decided not to eat all their meal, or they decided, they didn't like it that much, or say you gave them something that was really high in carbs and you gave them a really high amount, but then they decide not to eat that all, they're going to crash. And then you're going to have to try to come up with enough like liquid type carbs or spiky sugar type carbs in order to regulate that. So every meal, every snack, every food is kind of a challenge. So snacks in our house, we try to keep under, we try to keep those under 10, because if you remember, I said 10 carbs is half a unit. So if you're under the 10, then you don't need the half a unit, but it doesn't mean that it's going to make it a little higher. It is going to make her sugar a little higher. Hopefully she's in a range that's not really going to matter too much. It will just go a little bit up. If not, then I would need to make the correction the following meal. So she would be corrected for the numbers that she had. So say at lunchtime she was 250. And she was going to have 20 carbs. So she would need 1 unit for her 20 carbs. And then you also have math for what they feel a correction dose should be. So whether it would just be like a math problem, basically, that you'd figure out. You'd take their number, say 250, and then you'd subtract 150, and then you divide that by whatever number they give you, and then divide that number by 2, and that's how much you're giving them. So that would be a correction dose, and I would add the correction dose to what she was actually having for insulin. So that's how we do it every single meal: breakfast, lunch, and dinner. And then again, before bedtime, we check that and see where we're at. And then if we need to make corrections, if she's beeping throughout the night, which means that she's over 220, then we'll need to do corrections throughout the night as well. So at nighttime, like I said, we had to keep her higher. So if she beeps at 220 and she's only 222, I know if I give her a half a unit that it's going to be too much and she's going to drop too low at 4 a.m. So I'll push okay. And then if she beeps again in half an hour, because a lot of times she'll fluctuate and go down and up, down and up, down and up. So there might be nights, it's not uncommon for me to get up 6 times a night just to handle the monitor and give insulin injections just for her alone. I also have 2 toddlers. My 3-year-old pretty much sleeps through the night, but the 2-year-old really doesn't. Especially right now because she's not feeling well. So sometimes when I can't think, my thoughts and that type of stuff, that's me. So type 2 is not like that. You do not need to calculate insulin for every single thing because the insulin in your body still works. It's just that sometimes you're causing it to work overtime because of the diet that there is. So then it slows down in working, right? Because it's had to compensate for so long for the amount that's in your body. And mainly that's carbs. And everything has carbs. But if you are having lots of carbs, your body is giving out a lot of insulin, and it's almost like it tires the system out, kind of. So then it sometimes works, and then sometimes it doesn't, and it's not going to work appropriately because of that. So those are the two differences. One is more diet related and is not type 2 is more diet related and is not an autoimmune disease. Type 1 is an autoimmune disease where your immune system attacks your pancreas and your pancreas no longer works. Type 2, your pancreas still does work. It's just kind of fogged because of the diet. So those are the difference between the two. Now, what can we do in either situation? There is much controversy over this, but I have, knowing what I know, just in life in general, and how doctors work and how they want to make more money, I've looked into a lot of things on my own. So I think keeping a lower carb diet for either is appropriate. I also think eating real foods is appropriate. Goodness. I try to keep her carbs about 20 or under at each meal, and then her snacks about 10 or under at each meal. And that is completely doable. Some parents go a lot lower than that. Some follow Dr. Bernstein, which is, he's really great at all of it. And he has lots of good videos and that type of stuff. If you're dealing with type 1, go ahead and check out his videos. Just look him up on YouTube, Dr. Bernstein. And he's usually with some other guy. The guy's like 80, I want to say he's like 86 years old and he has type 1. And that is very, very rare. I think he's the oldest person with type 1 that is still living. And because insulin didn't come for a long time, he was one of the first people with insulin, but he also used diet with insulin to help prolong his life. And so we're kind of using that theory, although he does use some things that I'm not okay with, like sugar-free Jell-O that might have like aspartame or something like that. Like, because we've known that now, some of the things I might not agree with. I would rather have whole foods for her. And also it's difficult, I think, when somebody's 6 versus 16, because a 6-year-old doesn't understand, oh, I probably should eat more protein, because they're like, no, I don't feel like steak today. So as she gets older, like, those things will be encouraged. So then what do you do with the rest of your household? What do you do with the rest of your family? How do you incorporate this whole thing into your household? I really stopped making casserole type dishes, and it has been a huge, huge, huge learning curve. So I used to try to do like lots of casseroles, and it's really weird because this happened about a year after I had another daughter that was diagnosed with a different autoimmune disease. So we need to be completely, like, gluten-free for our family is ideal. Only eating raw dairy is ideal for our household. Like, I'm just trying to do one step at a time, because we were eating Before with Sweet Pea, we were eating gluten-free, dairy-free, soy-free, and only non-GMO corn. And that's how we were eating as a family. And then this happened. So then we're trying to figure out this. So I think the best way for especially our family is to eat real foods and to eat them separately. So you have a meat, you have vegetables, like quite a bit of vegetables, quite a bit of meat, and then you have a side of something. So usually that's another thing, like we used to eat like gluten-free pasta, and I stopped doing gluten-free pasta because really there's not a lot of nutritional value in it. So our main go-tos are potato, sweet potato, or like a starchy vegetable. There's other starchy vegetables like butternut, like that type of stuff. Starchy vegetable, and then sometimes rice. So those are what we eat for the other like carbier type things. And then it makes it easier, and we always keep salad on hand. So it makes it easier that way to be able to incorporate everyone's diet type things into the same thing. What do you think about diabetes?
I think that if people get diabetes, they have to go in the ICU.
Yeah.
And get some shots. Like, I go in the ICU and I got shots.
Mm-hmm.
And they have to get shots for their food.
Mm-hmm.
And
what's in the shot?
Medicine, like you.
Insulin is the medicine?
Yeah, insulin. The shots, like insulin is in the shots.
Yes, insulin is in the shots. So how do you think you should eat if you have diabetes?
We should eat like diabetes. Like if you have diabetes, you would. How you have to eat is like.
Can you eat meat?
Yeah, you can eat meat and cheese. And you don't eat a shot because it's 0 carbs.
Mm-hmm. It is 0 carbs. So, what are some of your favorite things to eat?
I like to eat like cheese, and I like to eat types of meat.
What did you have for lunch?
I had a salad with I had a salad with pepperoni.
Mm-hmm.
and cucumbers. And I didn't want the mozzarella cheese, so I just had my dressing on the cucumbers.
And then what else did you have with it? With your salad?
Orange.
An orange, yeah, like a little cutie.
Yeah. And I had a wrap with peanut butter.
Yeah, so then she had a low carb wrap with peanut butter, so that would equal about 20 carbs. About 20 carbs. And mandarin or a cutie is like 7, and then your wrap with peanut butter would be 7, 8, 9, and then the salad would be about 5, depending on the salad size and what she has in it. It just really depends. Cucumbers are like pretty much nothing, but the cheese and pepperoni. So what are some things that is different?
Things that are different.
How did you feel before you went to the ICU?
I felt like tired. And I felt like I didn't want to eat so much food. They had not healthy stuff there.
In the ICU, they did not have healthy stuff there. You are right.
It had like hamburgers, French fries, spaghetti.
There's actually a group of people that are trying to work on that because they're giving inside of hospitals, they're giving a diabetic diet that is not a very good diet, and it actually was causing more harm than good when we were in the ICU and caused us to have to stay longer, because when she would eat, they have to be able to eat and process the insulin okay before they can leave. But the meals that they were allowed to choose were just stuff that we didn't even eat before all this. Like big greasy hamburgers with like a big pile of French fries and then applesauce on top of that. I mean,
And they had oatmeal. We have oatmeal at home.
Mm-hmm.
They have oatmeal with sugar. I have 0 carbs sugar.
Yeah, so it's just like the differences of like, if she is going to have some oatmeal, then we'll measure out that oatmeal and then put in...
You can see your hands in there.
We have lots of people that want to be on camera. So putting in just a different type of sweetener or whatever in there, where and we can make it be around 20 that way, where some of the things in the hospital were close to 100 carbs for just like not even enough to fill you up, because there were the packets of oatmeal that already had like dried fruit in them and sweetener in them and that type of stuff. So just making conscious decisions on how to change things so that it works best. So,
I like when the milk is
do you like the foods that you eat with diabetes?
Yeah, I like some of them.
Can you still have ice cream?
Yes, I have my own type of ice cream.
Yes, so it's finding the alternatives for what works for you. There are low carb options in a lot of the things. So we are going to go to nap time because everyone's waiting for Mom so they can go to nap.
And there's 0 carb Gatorades. I like when there are 0 carb Gatorades.
And there's 0 carb Gatorade apparently. So I think the difference between us and some of the Bernstein factors are we want to eat real food, and not all of this stuff is real food. Some of it might be 0 carb, but it's not like food based. So just trying to find our medium and where it will work best for us and our household. So I know that I'm probably going to get some interesting comments in the comments. Please understand that I am making this to just share the differences from what we have heard recognized through the diabetes community. And it's more not to say anything against people that have type 2 diabetes. It's more for people to understand like the seriousness and the difference of a type 1 diabetic. There's really nothing like that they can do. So something that might be like healthy or on your diet plan as a type 2, like different types of beans and that type of stuff, those are all good foods, but it might not be at the level that we need to kind of be at this point to keep her stable. So we really just have to be very cautious in what we're doing so she can remain stable, because it's no fun having diabetes and being sick, huh?
Yeah.
So I hope you liked the video. I hope this helps explain some things maybe. And we hope you have a blessed day.